Howdy, y'all. I'm Dr. Jarvis, and I want to give you an update on one of our clinical performance measures and give you an idea of how we're doing and how we can do better, but most importantly, why this measure matters to our patients. Now, I'm talking about TBI 01 here. This is the clinical assessment of patients with a traumatic brain injury. What this looks at is what I would consider the very low-hanging fruit. This just says, this should be an easy measure to meet. It says, for patients with a traumatic brain injury, are we assessing those things that matter to the outcome of patients? Specifically, are we measuring systolic blood pressure? Are we measuring pulse ox, SpO2? And are we measuring ventilation rate, specifically end-tidal CO2? Now, the reason this is important is because each of these three things, these three vital signs, are independently associated, when messed up, with increased mortality and traumatic brain injuries. We know patients with one episode of hypotension have a fourfold increase in the risk of death compared to those who don't. Patients with hypoxia, one episode of hypoxia compared to those without that, have an sixfold increase in the risk of death. And we know that patients with hypoventilation have increased risk of death. Now, I'm going to flash up a couple of tables from a paper that specifically looked at ventilation and whether your ventilations were in target or out of target, normoventilation versus hyper or hypoventilation. And what they found is patients have up to a sevenfold increase in the risk of death, the odds of death. That's bad. We can avoid that by controlling ventilation. And that's consistent with our protocol, but the only way we can control it is by measuring end-tidal CO2. And our traumatic brain injury 01, TBI 01 measure says we're not doing a very good job of it. As a matter of fact, as you can see, our performance has been dropping. Now, Buck and Kirby dug into this a little bit to try to find out, what are we measuring? What are we not measuring? So this performance measure looks at, you have a systolic, a pulse ox, and an end-tidal. And obviously, almost all of this is imported from the monitor. So what we find is we're doing a really good job of measuring blood pressure. We're doing a really good job of measuring pulse ox. We're doing a really bad job of measuring end-tidal CO2. And this isn't a you forgot to type it in because it's imported from the monitor. Low-hanging fruit. Guys, measuring these things really improves the outcomes for our patients. It allows us, it gives us the information we need to treat these patients appropriately. Now, the last thing I want to do to help us improve is make sure we understand how this measure is calculated. It's really easy. We look at primary or secondary impression, and if it includes any flavor of head injury, that is our bottom number, our denominator. The number on top is the number of those patients that had at least one SpO2, SBP, and end-tidal CO2. That's how we get the measure. So let's appropriately measure end-tidal CO2. That's the low-hanging fruit. That's the thing that is most important to our patients. And then let's make sure we're documenting the impression. I think it is probably important for me to make sure that everybody knows what is supposed to go in the primary and secondary impression. This is your diagnosis. Your primary impression is the number one thing you think is going on with this patient. Your secondary impressions are the other things that you think are going on. For example, if you have a traumatic cardiac arrest would be your primary impression. The fact that they had a gunshot to the chest or they had respiratory failure that contributed to the cardiac arrest, that would be your secondary impression. So impressions are what you think are going on with the patient. It is not the dispatch nature, what dispatch said was going on. There's another field for that, put it there. It is not what the patient's chief complaint was. There's another field for that, put it there. It is not your differential diagnosis. Now remember, a differential diagnosis is different than what your actual diagnosis is, your actual impression. A differential diagnosis is before you start getting a history, before you start doing tests like blood pressures or ECGs or blood glucose. It is the list of things that you think might be going on that you are considering and that is driving your history taking and your physical exam. So again, primary, secondary impression, that's what you think is going on. Please do not use it for anything else. What you put in your chart really, really matters in how we assess the quality of our system, how we change our protocols, how we change our improvement efforts. All right, guys, so just to recap, primary, secondary impression, that's what you think is going on. If you think they have a head injury, really important that you assess end-tidal CO2, SpO2, and blood pressure, because keeping those in line, in normal values, avoiding what are called the H-bombs, hypoxia, hypoventilation, and hypotension, are way better for the patient. Those things increase mortality. We can decrease mortality by keeping them in line. Guys, thank you very much and have a great day.